Introducing Dr. Gyles Morrison. Dr. Gyles coined the term clinical UX many years ago and has been working as a clinical UX practitioner for over a decade. It was so interesting speaking with Dr. Gyles as we uncovered so much about clinical UX, as well as why arrogant leadership is creating toxic work environments, different forms of learning to accelerate your growth, and the impact that AI is having on healthcare and UX as an industry, as well as how Figma got it so wrong with AI. We cannot wait to bring you this episode, so let's dive right in. Enjoy.
Gyles, we wanted to kick off the discussion today just really understanding a bit about your career journey. Can you tell us, what you've been doing, how you got into this, just the timeline of your career?
Sure. So I've been in this field now of clinical UX for about 10 years. It will come up to 10 years in September of 2024. So in 2014, I decided to leave medicine. I loved working with patients. Just there's a lot of complexity with working as a doctor, specifically the moving house every year, the long day shifts, 12-hour shifts, the long weekend shifts, 3 days in a row, on calls. There's a lot of my life I felt like I was missing out on. And there's so many problems in healthcare that you just can't solve as a doctor. So I thought, okay, I've got these skills in medicine. I've got this passion for IT and technology and still helping people in general. How can I combine that along with interest in being creative and artistic to have a new career? So it was very much a leap of faith going into digital health back in 2014. And 6 months into my first role as a clinical analyst, which is basically a business analyst, but coming from a clinical background, and also completely untrained for the role, I might add. I was in that job for about 6 months when I heard about UX. It was an instructor teaching me how to use Actual as a prototyping tool. I know there's a lot of people don't really use Actual, which I think is a shame. I think Actual is a really wonderful prototyping tool, but that's another discussion. But yeah, when I had heard about UX, that it's actually a career, the process of learning about people's needs, finding the best solution to it, whether it's a new digital technology, physical technology, a new way of working, a new process or service, but doing that in healthcare. As a doctor, I was like, this seems like a great new way of making a difference in people's lives, making a difference in healthcare. So still a leap of faith, but it was the right one because, we're nearly 10 years later and I'm really happy with my career. So I think other key milestones in that 10 years definitely was starting a master's degree in human-computer interaction with ergonomics. I did that at University College London. That gave me a lot more insight into what I didn't know about UX and how to really optimize the experiences people have with technology and services. And I did that part-time so I could put what I was learning into real projects that I'm working on as an employee or as a contractor. And then as the years went on, I do a lot of teaching, whether it's like conferences or my own clinical UX course. I think that was quite crucial in being able to develop my expertise. But yeah, it was definitely a leap of faith after first studying medicine and working as a doctor for 3 years. And crucially, getting that master's in human-computer interaction with ergonomics and recognizing that there is actually a great career path that I could have coming as a doctor going into design.
Brilliant. Yeah, I think it's an interesting journey. I mean, starting as a doctor and taking that leap of faith, like you said, right, to go into something completely different, which I know even back in 2014, if I really think back, UX wasn't really, it was well known, right, but not that well known, not as much as today. I mean, now you've got loads of boot camps, you've got loads of different ways to learn, right? But how did you find actually learning about UX? I know you did a course, but was there a lot of self-teaching as well involved in that?
There's always some self-directed learning. In fact, when I tell anybody, when I do a lot of mentoring and coaching for people, whether it's in UX or other industries, and definitely with my former career as a doctor, there's always going to be an element of self-directed learning. But I find that self-directed learning is only effective if you've got a good foundation that comes from a formal course. It doesn't have to be a degree, doesn't have to be masters. I would suggest it's more than just a Google UX course, to be honest. But I think you do need to have that foundation because, again, you don't know what you don't know. And self-directed learning is supposed to building on what you already know. So there was definitely some self-directed learning, which has allowed me to carve out a career in clinical UX as opposed to a UX professional working in healthcare. Like, I've recognized specific knowledge, skills areas that need to be developed to work effectively when designing for clinicians and patients, which is very different to, say, if you're making a technology for e-commerce or fintech, which also has lots of complexity to it and domain specific knowledge. But I think the self-directed learning had to go alongside not just even the master's degree, but having mentors, people who have been there, done that, worn the t-shirt, but also peers, people who are on a similar path, who have been on this path longer than you, less time than yourself, but you share what you've learned, because then you can learn from each other. And then putting what you learn into actual real projects, so actually having work experience. So find that foundational knowledge, some sort of structured learning, self-directed learning to build on that foundation, having a network that you can feed into and that feeds into you, having mentors, and then you gotta do the work.
How did you go about that? Because I think that's like extremely interesting for anyone who's
Mhm.
new to UX to try and figure out, right? Like, they've heard about it, or they've seen someone, or bumped into somebody
Mhm.
that is in that profession. They've shown an interest, but like the way that you've explained it, it sounds quite structured, right? Like, you've got your self-directed learning, you've taken past experience, you've gathered some mentors, you're sharing.
Mhm.
Like, was that your thought process going into it when you heard about UX? Is that I need to have all of these things lined up, or was it, I guess, a case of serendipity where you kind of met these random people and said they were open and shared about their experiences too? Like, how did that learning, I guess, kind of come about? Was it like structured and
Mhm.
formal? Was it more kind of random?
Yeah, it's a good question. So it's become more structured over time, where I've then tried to explain it to others and help them on their journey. So what I've noticed is that teaching is a great way to learn, a great way to develop your own understanding. And I do a lot of teaching, whether it's very didactic teaching through, like I mentioned, the clinical UX course, or even through mentoring and coaching people. There's times where coaching is much more of an emphasis on asking them questions so that they can come to a realization. Whereas mentoring, you're just telling people how it is. You just give it to them straight. And in that process, it's allowed me to really understand, what did I actually do? And you do your little affinity diagramming of all the different stuff you did, and you put them into categories, and then you get those 5 categories of structured teaching, self-directed learning, networking, having mentors, and then work experience. But definitely wasn't as clear cut as that. Definitely, I was very conscious about making sure that I was surrounding myself with people that I considered smarter and more knowledgeable than myself. I think people who are really trying to do something new, key step is surround yourself with people that are doing what you want to do better than you're doing it, because then you're constantly surrounded by, but also the knowledge and reaching that goal. So Elisa Delgado is a great mentor of mine over the years. She's the one, I blame her for me going to do my master's. I used that word blame on purpose because it wasn't easy. It's a lot of money, it's a lot of time and effort, but it was definitely worth it. And she made it clear that if I really want to develop with my career, having some structured teaching as a master's degree and finding a real niche is important. And I agree. I've seen how that has really allowed my students to thrive and my peers to thrive if they're working in this very, very complex area of designing digital tools for clinicians and patients. So to go back to your question, I think it's hard to always be clear on what the next step should be. But then if you need to have a plan to take a next step, share it with someone, speak to others who can give you insight. Don't try and do this on your own. It's just too difficult. And also it's unnecessary to just do everything the hard way when there's others that have struggled who can give you insights.
Yeah, it's like what the saying goes, right? Like, you travel further together, and ultimately you do the same with mentors, right? I think when it comes to mentorship, that's a huge thing within the industry, whether it's in design, UX, tech generally. And a lot of advice that's given is find yourself a mentor. But like, how easy is it for someone to find a mentor? And how do you go about it?
I think it's quite easy to get a mentor. Most of the reasons why I find a lot of people struggle is that they don't actually have the confidence to just ask a stranger if they'll be willing to help them. The other problem, though, is that not all mentors are the same. That's why when I even talk more explicitly about mentorship, I always explain you should have more than one mentor. There's no one person that can provide you with all the insights that you have in life. Even when we look at raising children, people keep saying it takes a village to raise a child. And that's the attitude that you should have about developing yourself in all ways. There's never going to just be one person. Even if there's only one expert in the entire world on your topic, there's still something relating to that topic that other people could be knowledgeable on as well. So cast the net far and wide, speak to a variety of people. Because again, with mentorship, where people are teaching you based on their own experiences and knowledge, there could be biases there. There could be issues that they've had to overcome that you don't. Likewise, issues you have to overcome that they haven't. So again, going to just one source of truth to help you, you could be hindering yourself by not getting enough knowledge and insight to really prepare you for the road ahead. Definitely reach out to a variety of people. If you can afford it, getting a mentor that charges, because I charge for mentorship. I also give away time freely, but for like regular services, I offer a fee. That's because this is a service. We're going to have a structured approach. There's very specific techniques that I'm going to be employing, and you're going to have the whole of my time when we're going through this stuff. And there are a lot of mentors that, if I'm really honest with you, it's stroking their own ego. They want to show that they're an expert, that they've got loads of insight, so they're going to mentor people, and they're going to tell them, "Oh, fake it till you make it," type stuff. Feel free to lie in interviews, just use visuals that you found on Google, or take credit for someone else's work. They're helping to destroy the industry, to be honest. And you don't want that. You want to make sure that you've got mentors who are really doing it to build up our profession, because our discipline as UX, as designers, is definitely being attacked, I would say, whether it's maliciously or not. There's a lot of times where we don't have enough seniors who really know what they're talking about, managers who really know what they're talking about, which is another reason why seeking out that mentorship is so important, but also seeking the right mentor.
That's a great point there as well, Giles, about the leadership, the lack of it, and how design now is kind of getting diluted a little bit, with different roles in the businesses and whatnot. I guess around clinical UX, with it being such a niche area, did you have good leaders around you in that kind of space, or did you feel that there is a lack of leadership in that field as well?
There's definitely a lack of leadership for a few reasons. One is that I coined the term clinical UX in 2015 as a way of describing what I was doing, that whole area of focusing on the experiences of clinicians and patients and the experiences that they have with healthcare technology and services. It's very regulated, and understanding actually the complexity of what's going on from a scientific perspective. So why are you coming to that diagnosis? Why are you offering that treatment? And then the human factors that comes in, the ethical considerations, like it's complicated stuff. And there just isn't really the stringent adherence to rules and morality that we find in other aspects of healthcare. So drug development, new surgical procedures, just generally how to screen for disease. This is something we've got loads and loads of experience of doing. But there's something about making digital health technologies and software as medical devices that, even though there is regulation, there's still a lot of, for the lack of a better word, nonsense. There's a lot of stuff going on where people are taking advantage of people's ignorance of how to really make these solutions. And that leads to investment into the wrong ideas, whether it's monetary investment, time investment. And these are all telltale signs of poor leadership. When you've got good leadership, generally speaking, you're having continuous levels of success, growth, improvement. It's not that things are just be maintained at the status quo. if the status quo isn't really that good. Like the whole talk of 90% of IT projects failing, most startups failing within a couple of years. That status quo is very damning. That's a bad thing. That's not positive to hear at all. There's clearly something going wrong about management. Instead of being like, this is just how it goes, we are more likely to fail than to succeed, then you've already lost the battle if that's how you're thinking. So again, this is all leadership. When we look at empires, when we look at companies that have become monopolies, they've done that because of leadership. They've probably also done it through some backhand and very inappropriate actions. But it doesn't change the fact that someone had to plan to make that happen. So I feel like leadership is a massive problem within many industries, but definitely across industries involving design skill set, UX, problem solving skill set, and truly innovating and inventing and really making a difference. Like a measure of success is that people are happy using this solution. It's really solving a problem for them. I don't think there is enough education on this. I don't even think there's enough awareness that this is even a problem. So if there's no problem recognized, you won't fix it.
This is very, very topical at the moment in the industry. It's a key thing that, a lot of leadership these days is focused on opening up, the possibility of failure, right? And making people more comfortable with failure. And a lot of leadership is actually promoting failure, right? So saying to their kind of product teams, it's great if we're failing 90% of the time, because that 10%, we're really going to hit the mark, and we're really going to, that 10% is what's going to push us forward. So like, how would you respond to that? I guess a message that's kind of currently being pushed, because it seems as though you've got a converse approach.
Yeah, I definitely think it's wrong for us to think that it's acceptable for us to be failing fast. Yes, you can learn from failure, but you don't have to fail in order to learn. There's so many instances when we can learn vicariously. How are we learning from how other people have had experiences? What can we learn from them? This is desk research. This is speaking to your colleagues in the team about similar projects. There's ways that you can learn through actually risk assessing. You just take your time to review and see, is there any opportunity for a problem here? This is task analysis. This is a process map and you review it looking at pain points. This is heuristic evaluation, accessibility audits. This is usability testing. It's not like this is new stuff. So there's this idea that, because it's very topical when we're doing this recording, CrowdStrike I think it's called, they had that massive issue where they've pushed out that line of code that allegedly was not fully tested, which has crippled so many systems across the globe. I heard of like 1,500 flights couldn't take off, all because of this system. Even I had a shopping delivery, got delayed by 2 hours because of this. Can you imagine? Like, there's this one line of code cause all this madness. And it's all still down to just the basic principles of how are we learning that there could be a problem? How are we learning that this is the right solution? You don't have to just ship it to learn this. UXers know this. And I think non-UXers know it as well. It's not always that the non-UX professionals, the managers, just don't care. Sometimes it is, let's be honest. Sometimes it is that reason, that they are arrogant and ignorant of the reality of the situation. But there's times when they're being pressured by management above their pay grade, telling them, you just got to ship this now. Because that's the measure of success, is that it's been shipped, not that it's been shipped right.
This is like so interesting, because it reminds me of a conversation that I had with director of product at YouTube, Bengali Kaba. And he said something very similar to you, but he kind of framed it slightly differently. So he frames it he calls it understand work. So before you hit the ground running and you start shipping stuff, or you just ship anything just to kind of see what the results are, he says that you should take a significant amount of time doing understand work, which just means exactly what you said, doing the heuristic evaluations, even learning from the other teams, learning from your own team, learning from past experiences, failures, etc., before deciding on a direction. And what he said actually kind of goes against the idea of experimentation in a way. Not that he's against it, but it's experimentation is deemed, if you fail as quickly as possible, you're going to get to the answer sooner. Whereas he was saying that through understand work, by understanding the complexity of the issues and spending the time, you actually ship the product faster. Do you know what I mean? So if you spend that time up front, and can take the time to actually do your research, then you'll come to the right answer sooner. It's an interesting methodology.
It makes perfect sense. And like I said, I think a lot of UX professionals already understand this. And there's just so much pressure from the non-UXers to not follow this simple logic. One of the ways that I try to now phrase it is that we're trying to de-risk. We're trying to reduce risk of failure. And this sort of terminology, as opposed to improve the experience of users. Because if the users are going to pay anyway, what does it matter if they're having the best experience possible? But if there is a risk that you're not going to make any money, significant loss of money, in fact, could happen by a particular action, and we could remove the risk of that, suddenly heads start turning. And then when you start describing, as you said, like trying to better understand what's going on before doing anything, they tend to be a bit more acceptable and agreeable of such a way of moving forward. What I find very frustrating, though, is still this idea, like we've said, let's just ship it quickly, learn from that, make changes. The changes never come. The only time the change comes is if there's a fatal error, like it's impossible to use it, then there has to be a recall. Otherwise, let people just put up with it. We'll fix it sometime down the line, but then it never materializes. And we can't see this as acceptable because, particularly in my line of work, if there is an issue with the system and it changes someone's behavior, it can introduce risk of harm. I've seen where we've had forms that are used on an electronic health record to document what's going on with pressure sores. And the nurses found it too difficult to use this digital form, so they used a paper-based form, which prevented there being oversight of all of the forms being completed because they're on paper rather than digital, and then you can't run a report to figure out what's going on where. So that oversight of there being issues is reduced. So if there is an issue that doesn't get seen and there isn't an escalation plan to solve that, patients can be harmed because we've gone back to paper. But people are, it's just a change request. Change request is one of the most damaging things to say in a sprint team, the agile teams, because if it's a change request, it's almost always going to be lower priority than what's in the current sprint for the current new feature being made.
Reminds me of the term day two that I was introduced to when I first entered the industry. I was wondering, what is this day two? We're doing it tomorrow. It just never came.
Never comes. It just never comes.
Yeah. And Gyles, I feel like, this really nittles down to a lack of leadership in terms of process and making sure that things are done in the right way, right? This CrowdStrike thing that you mentioned, we're all seeing this now. There's clearly either been a rush to kind of get it out, which leadership hasn't actually thought about in terms of what impact could that have, or they've kind of neglected the process that they do have in place potentially as well, right? I'm keen to hear from you, just around leadership and, what does leadership mean to you, and, what makes a good leader, and why did you even get into leadership yourself?
Yeah. Leadership to me is about ensuring that success is achieved, not necessarily at any cost. There are prices that we can be paying which we shouldn't be. There's compromises that we might be making that can cause irreparable harm. So it's achieving success, utilizing the right tools, techniques, people, but with the right mindset as well. So I find that the best of leaders really are ones that are going to inspire trust, that the right decisions are being made. Because as a leader, you don't have to have all of the right answers. You don't have to have all of the skills. You just need to make sure that the right answers are found with people with the right skills. So there's definitely a humility piece that's important. And I think the reason why I have gravitated towards leadership is there's definitely a slightly arrogant part where I'm like, I'm tired of seeing this nonsense. Let me just fix it myself type attitude. But then there's also the side of, if I've got skills that lend themselves to leadership in the ability of making sure that the right problems are solved with the right solutions, even if it's not me doing that work, but I'm making sure I'm facilitating the right work to be done, I've probably got a duty to do that. That's how I'm seeing I'm contributing to society, trying to make healthcare better. That's one of the reasons I've gone more into that, because I've seen a lot of bad leadership in my time. You know, when people are like, you don't leave bad jobs, you leave bad managers. That's definitely been part of my testimony for sure. Like I've and heard things that come from leadership, which is just shocking, if not illegal, and actions where you have to question if they genuinely care about other human beings, that they genuinely care about doing what's right, as opposed to doing what's, in their opinion, best for the business. Like, you don't have to put profits before patients to have a successful business. You should always be trying to provide the best value that you can as a business, whilst keeping commercial viability in mind, but just do the best job. You will get the money. If you've got the business acumen, you will get the money as well. But solve a real problem, do it properly. So definitely there's a humility, recognizing you don't have all the answers, but you don't need it. Leaders do not need to have all the answers. They just need to make sure that the answers are there by utilizing the right people. And I think we need leaders who are also trained or at least educated on this. There's times people go into leadership because that's the only way that they can get a pay rise. And that's not appropriate. There's a lot of people in leadership who have got great skills at being an individual contributor. Just pay them more. Give them credit for the great work that they've been doing. You know, pay them so that they stay loyal. Pay them so they stay satisfied, you know, because of what they can achieve with this extra money that they've got now. They don't have to go into a leadership role for them to necessarily get a pay rise or want to stay. And I think that's one of the issues that we're having with a lot of leadership in UX now, is that there's a lot of UX managers, they don't come from a UX background, but also they may have completely other interests and skills that don't lend themselves to management, which means that they just shouldn't have been promoted or put into that role in the first place.
Yeah, this is a real problem, right? I'm quite passionate about this topic as well. You know, getting into it for the right reasons, knowing the switch of being an individual contributor versus someone that is now taking care of a team, and the best teams, the team's interest at heart, right? Yeah, and I can only imagine that in the field of clinical UX, it's even more of a challenge, right? In that kind of field as well, to find the good leaders.
Oh, for sure. What we find, there's a lot of entrepreneurs who are running digital health startups. Notoriously, it's a digital product, less so like a wearable or other physical device. They have a medical problem. They are related or otherwise know someone with a medical problem, or they're a clinician, almost always a doctor. So they either are a subject matter expert through training. You could argue that they're a subject matter expert because of experience. But that is specifically of the disease or of the ecosystem that that disease relates to, right? But they're not experts in design, they're not experts in finance, they're not experts in business, they're not experts in marketing. They may be very good storytellers, which helps them get investment, but there's a whole long list of skills that they don't have. But there's a combination of arrogance and ignorance where they think they know better, but they're also unaware of just how bad the situation is that of the problem they're trying to solve, but also how bad the solution is that they think is the great solution. And so they're not taking on insights from others. They are micromanaging staff. It's a very, very, very common phenomenon. Or they will blindly outsource particular skill set, like development is a big one, and be completely beholden to what they say or do because it's not their area of expertise. And it's like, well, I've outsourced this to you. This was my requirements. You'll just do it. So they almost like blind faith because they've signed a contract type attitude. And all of this is a setup for disaster. This is one of the common reasons why we see so many digital health startups fail. Failure being that they don't get investment, or they do get investment, but they blow through the cash before they can make a profit, or they are trying to make a profit, but the business can't scale because, again, it wasn't solving the right problem. It's a very, very tiny market that they are really focusing on. It's all links back as a root cause of leadership. They didn't make sure that they were working on the right idea. They didn't have the right people around them to make that idea a reality. And when it did become a reality, they didn't know how to nurture that from seed into a great oak tree.
Yeah. It's great. It's really interesting to hear this. And, because I think, as Jay mentioned earlier, the stakes are so much higher in this field, versus, if you put out a wrong product, it's not the end of the world. Okay, yeah, we might lose a bit of money, but we can roll back, right? But I think when you're talking about a field that you're in, the stakes are so high, right? And, I don't think we actually even got into it, right, Gyles, for the UX designer just starting out, what is clinical UX and how does it kind of, if you could explain it to someone coming into the industry that wants to kind of get into that, could you explain to us what it is?
Yeah, I would say that ultimately it is still UX work. It's still finding ways to improve someone's life through the use of science, through the use of creating new technology, new ways of working. That's ultimately something that we have made as human beings. When you're doing that in healthcare in general, you're doing it as a way to ensure that the health of other people is better. But you can do it in almost infinite number of ways. Is it a poster to get people to know more about the inappropriate amount of food that they should be eating and what proportion of different types of nutrients they should be having? Or is it going to the much further extreme, actually, of how we can have a digital tool that's helping someone with this super rare disease where there's very few clinicians who know how to treat them, but there is a body of knowledge on what best to do for these patients. Now, when you go from, it's a poster about nutrients, it's very easy to find that information and, got some skills in visual design and, persuasive copywriting and things like that. Those skills can be enough. But when it's like, let's deal with this rare disease, do you understand the rare disease? Do you know why it's rare? Do you know what the treatment is? Do you know what laws are governing the use of such a technology that could manage or treat that disease? So suddenly you're doing UX work, but there's so much more knowledge that you need to have. And your research plan could become so extensive that it's not just, I'm doing some interviews, I'm doing some contextual inquiry or observational studies, I'm doing usability testing. It's also, I now need to attend lectures on this disease, or I now need to learn about the regulation of software as medical devices. There is so much more that you need to learn when you're going into clinical UX, and it's not for the faint-hearted. And I was actually speaking with a mentor, Elisa, who I mentioned earlier. She's right when we say, if you don't like science, if you're not interested in that, this is probably not a career for you. Like, you shouldn't be faking it till you make it in clinical UX. If you really can't comprehend why a doctor goes through a particular process to come to a diagnosis, why they're doing certain investigations, why they're offering certain treatment, if you're not understanding why there could be side effects. So not saying that you got to know every type of molecule and how that connects with another one and causes this drug interaction. We're not talking about that deep science. We're talking about the fact that there is human biology going on, and there's also psychology at play, human behavioral science at play, human factors and ergonomics at play. And if you can't get your head around it, you don't want to get your head around that, leave this career alone. I think the other thing is, if you know that you love solving complex problems, but recognize that you may never find a solution, so accepting that you can't always have your way of finding the best solution and achieving success with that, then again, this could be a problem area for you if you can't get your head around the fact that failure is inevitable. It's just the nature of things. Just like my time as a doctor, where the stakes were even higher, where literally I could be writing a prescription which could kill somebody if the dose is wrong. I haven't killed anybody, but I've definitely had some wrong prescriptions written by me. This failure is inevitable. It's the human condition to error. This is just how it goes at times. And it's our job as clinical UX professionals to find ways to bring the risk of that error as close to zero as possible, but respecting the fact that it's impossible for us to completely remove that risk. So that's what I would advise people wanting to get into this field is recognize that this is science at work here. This isn't about making pretty pictures on Figma, which is just the latest tool that will be replaced one day. This isn't about just having great user interfaces, because even if you have the best user interface with the best user experience in this product, if it does not fit into the workflow of the clinician, into the lifestyle of the patient, it won't get used, and then it's useless. If you can't comprehend that and be okay with these sorts of things, leave this career alone. But if you genuinely want to make a difference in people's lives, if you really believe that the better use of technology and the better way of people interacting with each other can improve healthcare for all, then come join me, because we've got a lot of work to do.
This is so interesting, honestly, because I've worked across multiple industries, never healthcare, and I've heard time and time again, okay, we can make that trade-off because we're not saving lives here, right? And you're literally saving lives with what you do. In some cases, I can imagine, and the level of kind of detail and passion that is required must be really kind of immense. I think that kind of begs a huge kind of question for me: is how do you hire people, right? How do you bring on more clinical UXers into the industry to strengthen the industry, to make it better and push it forward? Because what you just described, you need to be a certain type of person with certain characteristics, and I'd just like to better understand, and so we can share with the audience what are those characteristics that person needs to have to be successful.
Really good question. So people can always be trained. They can be trained in skills, trained in knowledge, but generally speaking, if someone doesn't have a particular temperament, a particular interest, genuine care or interest, you can't just through training, solve that problem. It's just like having racist doctors. You can't have training overcome someone's racist views or sexist views or whatever, discriminatory behaviors that they have. Training doesn't remove that. So you need to make sure that in the process of interviewing, just like in the process of getting people to work, the process of interviewing needs to be seeing, well, does someone actually genuinely want to do stuff that helps human beings? And the reason why I see this as being a requirement, and a lot of times people talk about empathy, and that's different. Empathy is where you try to be in someone's shoes. I can't be in a woman's shoes knowing what it's like to be pregnant. I will never know what that's like. I don't need to. What I need to do is actually genuinely care that if there's problems going on, and have a genuine interest in making those problems go away where I can, where possible. That's what matters, the genuine interest. Because many of us, sadly, work in jobs that we don't enjoy. And to be honest, you don't have to enjoy your job to do the job. The job is a means for you to earn money so that you can live your life. But if in doing the job, you still don't even care about people, you don't care for their happiness, it's very, very hard for you to really find a solution that's truly inclusive. If you're doing research, you're doing design, and your job is to make sure that we've got health equity going on here, that everybody has been treated and given the support that they deserve, treated with the right respect, but also someone needs some extra help, so they give them more help. Someone needs less help, but they're still given extra help. This comes from genuinely caring about people. And I think that is definitely a hallmark of this. And what we said before about being scientifically minded, no, you don't have to be a doctor. You don't have to have a PhD. I think it is useful to have an undergraduate degree in a related course. But what really matters, actually, because you can be trained, you can acquire this knowledge. That's why people who have gone down a self-taught route can excel. There's stuff that you're going to need to know in clinical UX that is so complicated and so fast that if you don't know the basics, it's going to be hard to teach you the rest. It's like algebra. If you don't already know what your multiplications are and divisions and the like, teaching complex algebra is going to be hard. You got to know the basics first. So the basics really doesn't mean a medical degree, but it is something like psychology. It is something like not just graphic design, but when it's more applied. So it's not just the artistic side, but it's the creative side and being a professional who provides a service where actually you have to acquire insights about the brief and what's needed and find the best solution. Like there's a lot of graphic designers who are taught this. And that's the precursor of being a good researcher is, are you gathering enough insights to then do the more appropriate design process afterwards? You have to have the right data in front of you to go through a proper, effective design process. So first degree, I think, is useful. That's relevant, but don't feel pressured to have already come from a medical background, because especially if that was a requirement, we'd have so few clinical UX professionals. But be prepared to learn. And as employers, be prepared to teach if you're building out a workforce, or hire me. If you need someone as a contractor, you need someone already out the gate, or you need someone to build out a team. There are a few of us out there who have been in the field for more than just a few minutes, who know what they're talking about, who do come from a clinical background, or at least has been working on that intersection of clinical medicine and design for a while. And having us on board will also help with making sure that if you do have individuals who have got great potential, that potential becomes a reality.
I think working in products across like different industries, etc., a lot of UXers have an issue getting buy-in for research. I can imagine that you have the opposite problem, I suppose. Like you've
not at all.
Already encouraged to do more research.
No, we're discouraged from doing research. Remember, I was saying the arrogance and ignorance of what we founded. This still happens even with managers. They're like, well, the board of directors have said this is what we need to make. The senior vice president, directors have said this is what we need to do. Me as a head of is telling you now this is what we want. And we've got a product owner who's a subject matter expert in not designing digital tools, but of this aspect of the problem situation. Just do what they want. Like this idea of we don't need to speak to our users because we already understand them is very, very dangerous. There's so many assumptions that are considered the evidence, the data to use to make solutions that is very, very alarming. It's very dangerous, to be honest with you. I've seen instances where I have seen risk. Just intellectually, I've seen risk very early in my career. I've seen risk of a particular tool being used by nursing staff that's changing their workflows so that it's that of a more senior clinician, which would require knowledge and skills that more junior nurse simply does not have. I've seen that the workflow is going to change, and I see the risk, how this could affect patients. And then I'm being told by a senior clinician who's in an IT role as a source of truth, so to speak, of clinicians who just their gut instinct or what they think is right is seen as evidence to justify doing stuff. It's not through any research methods. It's just what they think. This kind of makes sense because we're like, of course you will go to a senior doctor when you've got a medical problem, and what they think is going on is what you should listen to. That's their professional opinion. But in context of treating disease, their professional opinion as a clinician in making a digital solution should never carry as much weight, because their professional opinion is about dealing with disease. Them trying to conflate professional opinion related to disease to making a digital solution is very, very dangerous. Because they wouldn't do it when it's like, I'm a cardiologist, I need the input of a surgeon, I'm going to just say what the surgeon would do. No, you go and speak to the other professional. But there's something about UX being so easy to do and so logical that why do we need to have experts? That's the unfortunate truth about this. So yeah, there is nowhere near as much research being done as there should be. And where there is research being done, it's being kept behind closed doors. There's so much insights about great work happening in healthcare, particularly in the pharmaceutical industry, making digital solutions for patients and clinicians. NDAs, trade secrets, sometimes journal publication. But when's the last you read a journal publication on PubMed? Hardly anybody does that. It's boring. It's very academic reading. It's very complicated stuff. You're probably not going to do that. And so again, the actual insights from primary or secondary research, that's a big issue within healthcare in general when it comes to creating digital solutions.
I'm so surprised by that. So surprised, given that the whole industry is founded on research and continued research. When applied to digital experiences, they seem to just like throw that out the window. That's mind blowing to me.
Yeah, because we've got to fail fast. Remember, ship it out quickly to make the money quickly. Because the measure of success is, are people using it and are they happy? I remember working on a team, right? And it was one of the data scientists. We were working on a project. I won't go into too much detail about the project, but he said to me that we know that we've done a good job if we can convince one person to use it. And I lost a lot of respect for that person at that moment, to be honest with you. A very, very intelligent person, PhD, very articulate, very knowledgeable, very capable person. But I can't think of any business that provides any product or service who would be satisfied with only satisfying one customer and that's it. There's no way that a business would be successful. You're talking about a business saying that we've had a customer who's then paid us $100 billion, $1 trillion, just to one customer. Therefore, we're okay. No business runs like this. You have to be seeing how you can keep multiple customers happy over time and with the changing in the market. This requires research. You can't guess this stuff. You can guess it, but it doesn't mean that you will be right. The only way of being sure is to do research. Some of the research is, I agree, evaluative research once you've launched, but you shouldn't be waiting too long. The risk of failure is far too high. We're talking about times where when this business fails, we've got people that are on a visa to be an employee. We've got patients who are relying on this technology or clinicians relying on this technology. We've got investors that put in their life savings. That business fails. All these different types of people have got suffering in their life as a result. We've got to be seeing the businesses as being an essential part of people's lives because they are. They're paying people's bills, right? They're keeping people alive. We need to make sure that these businesses are being run correctly. There needs to be better leadership. But to your point, there needs to be more research. And sadly, it's not as prevalent as it should be in digital health.
And what's interesting hearing all this, Gyles, is that it's similar challenges, not to the level that you're saying, right? Because obviously the level you're talking is critical, right? But I'm just kind of getting flashbacks of organizations I've been in, places I've worked, the lack of research, the lack of understanding. You spoke a bit about, that whole thing of someone saying that I wouldn't use it, that false consensus effect, right? That we see all the time, right? It's incredible to see that those same challenges exist in that field,
Yeah. There's a lot of, as I mentioned, arrogance and ignorance, but there's also a lot of fear. There's a lot of people who fear that they're going to lose their job. There's fear that they're going to be exposed for being a failure, for allowing something bad to happen under their watch, or that what they sold as a good idea ended up being a bad idea. So they're trying to save face. There's a lot of covering up. We see this actual clinical practice. We see clinicians doing this, non-clinicians doing this, managers doing this within healthcare services, whether it's private sector, public sector. It's no different, sadly, in digital health.
So, Gyles, we know you're part of the Clinical UX Association, right? I believe.
That's right.
Can you talk to us a bit about that and how you're helping to change these kind of things that you've been speaking about, right? And how you're helping to kind of shape the industry in the right way?
Yeah. So in the early days, the Clinical UX Association, CUXA for short, has really just been a way of building community. I was feeling very lonely, so it'd be nice to have some other people around that have similar views to me, but also are working in this field of clinical UX and sharing what we've been learning from that. As the years have gone by, it's become apparent that what we really also need is a professional association. So it being, formal membership, there being training courses, which has already started now, it's been going on for quite a few years, but also a way of lobbying for change, having white papers, having manifestos, having very clear guidance on how best to utilize UX skills and knowledge within digital health, within healthcare service delivery in general, medical device manufacturing and the like, and getting this to government. So that's the next phase, really, is making sure that we've got a critical mass of members, but also of clear guidance, actionable guidance, recommendations, insights, so that governments are not just providing regulation, but regulation that is easy to adhere to, but also laws that are fully. And finally, for businesses to actually feel incentivized to follow this. Because at the moment, they are more so incentivized to just find workarounds to maximize their profits. There still sadly isn't enough of an incentive for them to think, I am going to have great UX because that will make me money. I need to make sure that the clinician and patient experience is the best it can be, because that's going to lead to more profit for the business. There isn't a common dialogue or logical flow for a lot of these non-UX professionals to commit to having great UX resource in-house or being utilized even externally. And so that's another part of what the CUXA is about, is really making sure businesses can succeed. Like, healthcare is not altruism. Good health is a basic human right. Everybody deserves to be healthy. But the mechanism to get that good health is so multifaceted, where people have it as their profession, that it can't just be altruism and, volunteering. It's not sustainable. We may want it to be, but it just doesn't work like that. And there's going to be some people, because of the money that they've got, they're going to want a slightly different service. They want something that's more private. They want something more luxurious, whatever it is, but they can pay for it. So yeah, pay for it. That's fine. But there's also a whole lot of people who, for a variety of reasons, social determinants of health go into more detail about it, but for a variety of reasons, they need a helping hand. And we need to serve all of them, but recognize there's a price that we pay for everything that we do. That's why we need to have businesses that are mindful of how they're using the money, how they're actually really providing the services that they provide, and for governments to think about this as well. So that's what the CUXA is about, is making sure that businesses working in healthcare are thriving, but are doing what they need to do to make healthcare equitable, and making sure that that right of good health that everybody is born with really manifests into good healthcare services for them.
What's the response been to the work that you've been doing in this area?
Yeah, it's been very, very positive. It's been light work over the years because I've been doing this alongside permanent employment and being a parent. But everyone is very, very receptive to this who's working in clinical UX, because very often they're working alone. They might be in an organization that has got tens of thousands of professionals, but they're in their team, they're the only UX professional. Or if they're in an organization that's got a lot of UXers, they don't necessarily work with those other UXers. They are in a team where they're still on their own. The other issue is that there's a lot of these UX professionals who have got the right attitude, the right mindset, and the foundational knowledge to do exceptional UX work, but aren't given additional support, knowledge, training, so that they can do effective clinical UX. Like, a question I get asked by so many UXers working in healthcare is how best to do research with clinicians because they're always so busy. And the truth is, it's not as complicated as they think it is. There's times when, if they're in pharmaceutical industry, they don't have access to clinicians legally, because the way of doing research as a pharmaceutical company, you could be inadvertently selling to them. So you need to do it through a third party. But again, there is that mechanism. Do it with a third party to do the research, provide the insights to you. There's some pharmaceutical companies that have an innovation lab. So that is a separate legal entity to the pharmaceutical company. So they bypass the whole issue of the pharma company directly dealing with the clinicians. So there's ways and means to do it. The point is that is the employer finding the best way to help these UX professionals do the great work. So the UXers working in clinical UX, there's a huge demand and a lot of receptiveness from them. I think the healthcare companies themselves are still so unaware of the power of UX beyond user interface design that for sure they are not capitalizing on this. But you make enough noise, you'll be heard. So that's one of the key things for us now is events, marketing material, but also just being valuable and useful to UX professionals working in healthcare. Because when they say that this resource has been useful, this person has helped me out here, that news will spread and it will grow. And, that's the plan.
The Clinical UX Association seems like, or sounds like something that is very much needed in the industry. So I'm glad that, we can kind of use this platform as well to kind of promote it. It also sounds as though, based on what we were saying earlier around the lack of kind of strong leadership in the area as well, that it's a source for those who are, like you mentioned, UX teams of one working in this area. They can actually go to mentors or go to yourself as leaders, not necessarily for their companies, but leaders in the industry. So you can kind of advise them on best practices and approaches as well. So I think this is an excellent thing. I think definitely like one thing that I want to kind of touch upon, especially around the leadership piece that you mentioned earlier. There being a lack of leadership, people gravitate into kind of US Association as well. How do you push the agenda of research within the organizations and kind of help others to do the same? Because it seems as though it is kind of quite a battle to be had in terms of that investment in the right research and the right kind of skills and capabilities in-house.
So there's quite a few thoughts here. One, for sure, if you've not already done so, read the book UX Team of One. Those listening, I think that's a really, really great book to get insights of what to do when you're a UXer who feels isolated or is literally working on their own as a UX professional. Some of the key insights from that book is highlighting that building relationships with colleagues, with seniors, so they actually respect you as a person, makes them, but in turn, respect the work that you do. Normally, that's how it works. Because this is how a lot of people get promoted who, for the lack of a better word, are assholes. Someone likes them and they get the job done. So even though they're not a very nice person sometimes, actually, they're likable to some other people. And crucially, they get the job done. So of course, they will continue to stay. Because there's also a cost associated with replacing them. The loss of that resource, the cost of bringing in someone new, and the loss of effective work being done as someone's been trained and settles into the role. So let's keep this person. The same thing is going on really with us as UX professionals. If you're doing more research as a dedicated UX researcher, or you're a UX professional that does research as well, which I think we all should be, you need to make sure people can get along with you, that you're approachable. You don't have to like these people and see them as your friend, invite them to your wedding and whatever. Like, it's not like that. I'm saying you've got to still be able to get along with these people and make them start understanding your work, not so that they can do it for you, but understand that actually this is complex. Because most people who are not developers, when a developer says it's going to take me 5 days to do this, they're not questioned, because there's an assumption that the work is so complicated, if they've been told 5 days, that's just it. And there's a respect for that person, especially if they've done good work. But for sure, the mystique of it also is contributing to why people are like, let's just not question this. For UX professionals, there's too many times when we're actually getting other people to do the research. And I don't just mean like someone else found some articles and gave me some insights. No, that's actually quite effective research. What I'm saying is someone else spoke to a couple of people without any training on how to do semi-structured interviews, how to make sure that the questioning is unbiased, how you're not leading the participant in the research that you're doing. Like someone who's really not sure, that they just found answers to validate what they believe is true, as opposed to going on a journey to explore the possible and really understand what's going on. So there's a biased, inappropriate research practice going on, and we've allowed that to happen on our watch. That we need to stop that from happening. Be involved in the research. Actually let them do such research with you present, so you can say to them, I think you could have gone a different way. And then there's a learning piece that goes on. And hopefully they haven't just learned that they made a mistake. They've learned that maybe they shouldn't be doing it at all. They should be getting a professional to do it. So the relationships is a key part of this, because it's a journey that you're going on that is not going to be a short one to make things better, because most companies have got very, very low UX maturity. I don't know if any company has got high UX maturity. Even the likes of Google, Apple, there's nonsense that comes out of those companies. You can't say that they've got the best, highest level of UX maturity because they're hiring loads of UX professionals. That's like saying a restaurant that hires loads of chefs must have great food. No, it doesn't work like that. There has to still be skill and leadership to make sure that you get the right output. So relationships are key here. Making sure people understand why you're doing what you're doing, but don't give them so much power over the work that you're doing that they're doing it for you. Come as an expert, make it very clear. And there's going to be still times you're going to get pushback. And always, if you recognize a problem, raise the problem. You're not happy with how research is being done. You're not happy how research insights are not being put into the design process. You're not happy how designs are not being tested, whether it's a digital product or service, and there's no testing going on. Raise this. Make sure it's in writing, not just a verbal, so that when things go wrong, you've been seen as a source of truth, but also by highlighting what the solution should be, you're the source of resolution to these problems. Don't just complain, because that's another issue. It's not foresight. We can just see with our own eyes, own ears. There's a problem here, and we know this is what needs to be done to make it better. Explain this respectfully to people. Speak up to them like they're your boss, but speak down to them like they're a child. What I mean by that is be respectful, but make sure that you've used such simple language that there's no confusion in what you're saying. So that when it's written down and the problem does get faced and you've explained what the solution is, people have to lick their wounds and come back and ask for your help and recognize that you're a source of truth of what the problems could be and how you can resolve it. And unfortunately, though, this isn't always going to work. There's still going to be environments that are toxic positivity, toxic belief that everything is fine, belief that your skill set is not that important, not that valuable, is just reduced to just doing UI design work, and maybe you have to leave. This is another thing. It's important that we normalize saying that some work environments you shouldn't be there. You should actually just leave. Don't try and make it better. You know, you might need to stay in there for a while to make some money, but your mental health is also important. So protect your mental health. Don't stay in these toxic environments.
To be actionable. I loved that segment. I think people listening can definitely take away a lot from that and can take it into their place of business. But one thing I wanted to just kind of double click on here is that you mentioned a lot around having conversation. So like not just kind of getting to know people, but actually I liked how you said like speak up, you know, like an adult kind of thing, and then it's kind of speak down like a child. Like a lot of people are uncomfortable with conflict, right? And that might kind of come across as a point of conflict, and you know they want to be nice to everybody, etc. Like, what would you recommend for those people in order who are working clinical UX to, you know, I guess boost their voice at their work?
Yeah. For one, mentorship and networking. Find others who have done what you're trying to achieve here, so you can recognize that what you're aspiring to have is achievable, right? Because there's all these other people that you've spoken to who are doing this. They are standing up to issues that they're facing in the workplace. The other thing is to then accept that actually you can't be people pleasing. You're always going to upset somebody in life in general. Like, just a truth of being an adult or even as a child. Not everybody's going to like you. Not everyone's going to agree with you. And that's okay. What matters is your objective in your job being achieved in a way that you're comfortable with. Because again, we can be doing our work as a researcher and a designer. You know, we get our paycheck, our bills are being paid, but we feel horrible inside because there's a compromise being made. You don't want that feeling. But if actually, when you speak up, people are receptive, this is a positive thing. So recognize that there's other people that have gone through this situation. Speak with them, share what's going on. Because on a one-to-one, case-by-case basis, there's maybe some specific strategies that you might learn from colleagues within your organization, within your team, or with the client that you're dealing with. Or you need those insights externally, an external perspective to say, actually, you're in a toxic environment, just get out of there. Or have you considered asking or suggesting this? So I think that's important to speak to others. I think the other thing, apart from also, as I mentioned, recognizing that you have to have conflict sometimes. Conflict is normal. It's a normal part of it. There's a conflict doesn't have to be abusive. It doesn't have to be disrespectful. You can disagree with someone and still respect them, still be able to work with them and achieve goals. And when you've made that clear decision that that's actually true and you can accept that as a truth, it makes it much easier to have those conversations. But be clear on what it is that you're wanting to achieve and why. Have the evidence, have your receipts, so to speak, so that you can present this. I think to the point as well of having relationships, really try and understand the perspective that someone else has. Like, are they really driven by metrics? Are they driven by achieving, success by having as much downloads, as much profit being made? Like, that's okay. If you understand that, shape your reasoning of why they should be doing what you're saying with that in mind. If you don't do what I'm suggesting, if you don't do these actions, your desire of having profit is going to be compromised for X, Y, Z reasons. If you're wanting to measure, this is something I can see that's going to counter it and it's going to lower the values, lower the success of what you're thinking. This is really important, that if you can't just keep talking to people from your view of, we've got to just do what's best for patients. Like, this is true, but if the business runs out of money and cannot provide its services anymore, you also have failed the patients. So you've got to be seeing it from the perspective of the people that you're speaking to as well. What is it that they care about? And how is the problem that you've identified going to be a problem for them? Because they may not even be aware. It's not on their radar that it's a problem sometimes. Sometimes they're very aware and they don't care. And again, toxic environment, you have to leave. But there's time when they genuinely don't know, and you are the source of truth. You are educating them. You're providing value. Your professional opinion and insights is what's helping.
It's amazing advice, isn't it? I think this is great advice for any designer, because I feel like it's a role that, there's a lot of vulnerability that's there, and there's a lot of anxiety that comes with that role, because it's hard being in an environment where no one fully understands how to utilize you.
Yeah.
Or fully understands the breadth of work that you need to do. And I think that advice you gave there was fantastic. And I think one of the sad things, or slightly sad things about that, is that I feel like similar conversations have been had in the past about this, and it's still something that keeps coming up.
Yeah, it's almost never ending.
Where do you feel we're going to be in the next 10 years, though, Gyles, with this, with design, and not just clinical UX, but just design in general, right? Where do you see the role of the designer going in the future?
I actually am quite concerned in the short term. Figma in particular is very concerning. Their use of AI and how AI has been utilized across different industries is very dangerous. I'm not talking about the whole Skynet thing or it's being racist or whatever else or offensive. I'm talking much more in regards to the promise of it solving problems that it can't solve in the interest of making more money for whoever's selling these AI tools. And it's selling cost effectiveness of particular tasks or behaviors to be done in a team. And so there's definitely this push to try and have Figma and other design tools be used by non-designers to achieve exceptional design work, forgetting that there's both a science and an art to the work that we do. There's science that is rooted in facts, in evidence, in research methods to acquire the evidence, and artistic skill for expression of emotions, of trying to help people comprehend the incomprehensible at times, to inspire, right? And there's a creative process which is kind of in middle of science and art, where you're inventing, you're coming up with new things which may appeal to our emotions on a visual level, but are also solving problems on a behavioral one. And then at a reflective level, we're like, I'm actually proud that I'm using this tool, or I'm proud that I've made this, or I like how this makes me feel and what it does for my legacy. And all these sorts of thoughts and processes that come into mind means that what we're doing is an inherently human thing. If you just deal with the noughts and ones of it all for a digital solution, to do all of that human aspect, it's only going to be as effective as it's been trained to be. And quite frankly, I don't believe that humans are capable of training an AI to really replace a human, because there's infinite possibilities of good and bad that a human can do. So where there's this over-reliance on AI to do stuff to make life of humans easier to the point that it's replacing humans doing it, when there is an artistic expression and when there's a desire to fundamentally change how humans are behaving, this is very dangerous. It's getting the whole problem-solving process being removed, as opposed to being assisted and assisting humans to do that problem-solving process. It's removing the humans, and it's going to reduce the actual effectiveness of that problem. So we see this in digital health, where AI is being used to diagnose patients, but it can only be as correct as the information that is fed. It's not reading faces for emotions. It's not actually understanding the healthcare record that isn't accessible to it. It's just reading this healthcare record that's been given to it. It's not recognizing the fears and the emotions and the desires and the plans, the personality traits, the fears that the patient has when it's making its diagnosis and treatment plan, which is what a human is supposed to do. And the same thing is true for design. Designers are having to be holistic and future thinking if they really want to have a solution that's going to make a difference. They're having to invent stuff that's never been seen before at times, or at least innovating with what we have seen to make something new, and then testing it to make sure it's really going to deliver on our needs. And again, AI is not going to go through all of that process. It can assist us though. So the fear though is that there's a lot of companies, there's a lot of these arrogant, ignorant leaders who are believing the hype that AI can solve all of our problems and it can actually replace us, which is then going to lead, I fear, to a decline in the use of our skill set. But like with any problem, a solution has to come at some point. And where the problem comes that the AI is not delivering, we'll see these business leaders realizing that they've made a mistake, that they need the humans, and we're going to have to come back. And the ones that are going to be wanted the most are the ones that do recognize the strengths and limitations of AI, but also the strengths and limitations of human beings, and how together we can achieve more than we can as separate entities. So I think design does have a bright future, but I fear that we're going to have a decline to begin with. But I stay optimistic that if you're doing what you believe is right, using the right skills, processes that is core to being a good designer, and genuinely caring about people, we're going to have a better place for designers. Bruce.
Yeah, I mean, very eloquently put there, Giles. I think, I think it's a fear that a lot of people have, that it's going to replace designers. And I totally agree with all your points there, right? You can't replace creativity. You can't replace innovation. We don't even understand it ourselves, right?
Yes.
So how could we ever, compute that or build that into a system to replace us,
Mm-hmm.
And all the other factors you mentioned as well. So, really interesting to hear about that.
Yeah, I think especially the point around Figma, especially with config that just happened, and all the AI features that were released and all the noise that it's making. there is a huge risk of over-reliance on these tools and features. And I do actually agree with you. I was talking to a friend of mine kind of post-launch of those features. And there does seem to be a heavy push on allowing non-designers to solve problems through these AI tools. And the biggest agenda for Figma at the moment appears to be not to necessarily serve designers and now engineers that are using it heavily, but more so to serve people who don't have the skill set whatsoever. And that is quite a risky strategy for the existing user base, I would say.
Yeah,
Designers and engineers, because it could potentially make them obsolete or make them not want to.
Yeah. One of the things, particularly with Figma, they were paid a lot. I think it was about $1 billion by Adobe for that failed acquisition. They were like, let's make something good out of a bad situation. We've got this $1 billion. Let's invest it in AI. Let's find some new value so some other company could buy us out. And I genuinely believe that when this eventually fails, when it runs its course, that is going to be a giant that's going to be on its knees. I really believe this. We've seen this with other companies, very grandiose ideas of what they can do, even if they've got a great solution. I think of Babylon Health saying, oh, we've got a digital tool that can actually make a diagnosis and offer next steps. And many times it's missing heart attacks, it's missing strokes, it's really making mistakes. And as a business, it provides a service to see a general practitioner, but not every consultation can be done through telehealth. Like everybody knows this. There's going to be times where you actually need someone to lay hands and actually recognize what's going on with your body, right? Blood tests, investigations, and the like. And all of their stuff are based in London. So if you're in Birmingham, you're in Manchester, you're in Scotland, you're screwed, right? And so that business in the end failed. There's many other reasons for it. I can't get into all the details, but like there's very grandiose beliefs of what it could do, and people believe the hype. But then when it ran its course and proved that it couldn't, it folded. And then another example comes to mind is Pear Therapeutics. They had great digital therapeutics to help people that had various drug addictions, right? And it really does actually work. But to use it costs about 80-70% of how much it would cost to treat these people anyway, even if they didn't use the digital therapeutic to support them. So it's like, there's only a little bit of a saving here. So why should we as health insurers reimburse the cost of this? Because it's thousands, and the patients aren't going to pay thousands out of pocket, especially in the US, if they're already spending about $1,000 a month on their health insurance. So people weren't paying for it. So if FDA approved solutions that are proven to work, that's why they're FDA approved. But people are not going to pay. So even if you've got a great solution, you need to really recognize the bigger picture at play. But again, there's many times that this is affecting us across industries, and Figma is an example of this. They're like, let's invest in a solution for people, solve a business problem for people, but actually I think they're going to shoot themselves in the foot because it's inherently relying on a false truth that design work can be done by non-designers and should be done by non-designers, and because of that we don't need designers anymore. That's what I think is a belief that they're working towards to help with their business. And for sure, short term, there's some multimillionaires being made from this, but some giants are going to fall soon.
I think this is a very kind of controversial and bold point to end on. And, I think I just want to say like a huge kind of thank you for all of your insights today, kind of Gyles, like lots of things that including myself, and the audience can take away from this conversation. I've learned a ton of new stuff, especially around clinical UX and all the great work that you're doing. For anyone that's listening, how can they contact you? How active are you on socials?
Sure, yeah. Please do reach out to me on LinkedIn. I'm there most days, even on my birthday. I check a few messages now and then. So Dr. Gyles Morrison, Gyles for Gyles. I do sometimes use X, formerly Twitter, not that commonly. Instagram as well, just but it's even a Google search. You can find me on my website, drgylesmorrison.com. But please do reach out if you're new to the field of UX. You want to find ways to get in. If you're new to the field of clinical UX, again, reach out. But if you are in this area and you know you want to develop yourself more, or you just want to be around kindred spirits, again, please reach out. This is how we grow as professionals and grow as human beings, is through connecting. And I'm happy to be reached by anybody. And thank you again for having me on your show. It's been a real pleasure speaking with you both.
And a pleasure
Great as well, Gyles. Thank you for coming on.
Thank you.